I'm here today to talk about the presentation I've given at the American Academy of Neurology meeting. As you may be aware, there's a lot of excitement in the migraine field about 4 monoclonal antibodies directed against CGRP and its receptor for the episodic and migraine and chronic migraine treatment. At this meeting, I presented data from the placebo-controlled double-blind study and the open-label extension of the AMG monoclonal antibody, which is directed against the CGRP receptor. This was a double-blind, placebo-controlled trial that lasted for 12 weeks and then had an extension where everybody received the active drug for up to a year. The patients were randomized to either placebo or 3 doses of the AMG product. The randomization was such that patients had 1 chance out of 2 of getting placebo. At the end of 12 weeks, all patients got the active drug at the higher dose of 70 milligrams, and the drug was injected every month. What did this study show? It showed that the 70 milligram dose was effective in terms of the primary and the secondary endpoints, which is the reduction in migraine days and 50% improvement. The lower doses did not separate from the placebo, but when all the patients, either placebo or the lower dose, was switched to the 70 milligram per day month dose, all the patients showed the same improvement, and there was no lag after 1 month of patients catching up to the patients who had been on the 70 milligrams initially. At the end of the open label period, approximately 20% of patients were migraine headache free for the last period of time, and over 2/3 had a greater than 50% reduction in migraine headache. What's most important, if when looked at the tolerability, there was absolutely no difference between placebo and active drug. In addition, there were no signs in either terms of chemistry or EKG in terms of abnormality. This study demonstrated that the AMG monoclonal antibody against the CGRP receptor was safe and effective for the treatment of episodic migraine, and further trials are clearly indicated. It's important to realize that there are 3 other drugs in the monoclonal antibody pipeline. The AMG compound, which I talked about today, was directed against the CGRP receptor. The other 3 drugs from Alder, Lilly, and Teva are monoclonal antibodies directed against the ligand, the CGRP ligand. All the drugs have reported data, and all the drugs have proven to be safe and effective in the treatment of either episodic or chronic migraine. What this tells us is the following. Using CGRP as a target, all the monoclonal antibodies directed against it or its receptor are effective for the treatment of migraine. More important, they're as tolerable as placebo, and there's no signal of safety abnormalities in any of the drugs. This opens up a new way for patients with migraine to be treated. We've developed a specific target based on the evidence that CGRP is elevated during a migraine attack, and the earlier studies showing that small molecules directed against the CGRP receptor were effective in migraine. This is exciting. It's a new treatment. It appears to be totally tolerable and safe, and I'm very excited about new approaches to migraine treatment.